The intern lifted the woman's legs high up and then injected her with a muscle relaxant. After the woman was completely relaxed, the doctor administered anesthetic gas to her. Within just a few seconds, the woman lost consciousness. The doctor then pried open her mouth and inserted an oxygen tube. Finally, the doctor taped the woman's eyes shut. However, just as the doctors were preparing for surgery, the anesthesiologist suddenly stood up. He discovered that the patient's blood pressure was dropping rapidly. This made all the doctors nervous. Fortunately, after a short while, the woman's blood pressure returned to normal, which made everyone breathe a sigh of relief. But just as the surgery ended successfully, the woman fell into a coma. No matter how the doctors called out, the patient showed no response. Even the woman's pupils showed no contraction. The attending physician immediately went to examine her and subsequently announced that the patient was brain dead. However, what was strange was that the woman originally had no diseases and there were no abnormalities during the surgery. After consultation among several doctors, they speculated that the woman was allergic to the anesthetic, as this happens to 1 in every 100,000 people. The hospital classified this incident as a probability event, but Dr. Anna wanted to uncover the truth behind it because the patient happened to be her best friend. She began reviewing the surgical records. Although there were no irregular procedures in the records, Anna still discovered a suspicious lab report. The hospital had conducted tissue analysis on the woman, but an abortion procedure doesn't require this test at all. What was even more bizarre was that there was no doctor's name on the lab report. The husband thought it was just a mix-up by the laboratory, as the hospital had already investigated this accident. However, Anna still felt something wasn't right about this matter, so she went to the archives and retrieved a list of all brain-dead patients. Anna didn't expect there would be so many patients. Then on this very day, a new patient arrived at the hospital. He needed a very simple appendectomy. Little did he know that once he entered the hospital, he would never be able to leave.